Local hospitals are now scheduling surgeries that require an overnight stay after Ohio's Director of Health lifted those COVID-19 restrictions earlier this month. They're still taking precautions amid fears that we could see another spike of cases in the virus, and we are in the middle of a pandemic. Joining us for this week's Doctor on Call is Dr. David Kirkpatrick, Regional Chief Medical Officer at TriHealth Bethesda North Hospital. Thank you so much for being with us this afternoon, Doctor.
Thanks for inviting me.
So where do we stand? I want to start with that. You've talked with your colleagues across all hospitals. We're seeing spikes from other states. Are we seeing any hot spots here that you know of in Ohio, Hamilton County, so forth?
In the Hamilton County area, this whole area, the southwest part of the state, is called Region 6, and we have a discussion a couple times a week with all the leadership of the hospitals in the area, and we're staying pretty steady. We're not really having any major spike at this time, which is good.
It's really good when you consider others are seeing a spike, and we have had quite a bit of opening here. Is there anything that you can attribute to that?
I think we've overall done a pretty good job at doing the social distancing and wearing our masks and being smart about how we behave around one another so we try not to spread this virus.
One of the things, and we've talked about this a few times, Doctor, is people having a fear of going to the hospital because of this and then prolonging or putting off issues that need to be addressed sooner rather than later. How much of this do you think you're seeing, and what do you want to say this afternoon to allay those concerns and get people to take care of themselves?
Yeah, it's a good point. We're definitely seeing that. What we want to know, we want people to know across the region that we're safe. We have been dealing with this since early March, and we're comfortable taking care of patients with the coronavirus. We're also comfortable taking care of patients that don't have the coronavirus and taking care of what their needs are. We're seeing patients coming in now who are sicker than our average patient prior to the beginning of March for the very reason that you talked about, where they've been staying home waiting.
I have about 20 seconds. Are people having a hard time getting appointments now? Is there a backlog? I know I've left a couple of messages and haven't heard back, if I may say. And I'm told it's now that they're reopening offices, there's so much need to get in.
We're not seeing that here. I'm sure there are one-off areas where there is a backlog, but overall, we've been really trying very hard to get folks in and get them accommodated because we know they need to be seen, and we've expanded our hours in our offices for that very reason.
All right. Dr. Kirkpatrick, appreciate as busy as you are for spending the time with us, and we hope you'll check in with us again soon and keep us up to speed on what's happening. Serious times.
Absolutely. Thank you.
Okay. All right. Let's turn to our